Good morning, Peter Goertz. I'm a psychiatrist. Treating depression, that's one thing that constantly confronts you if you're a psychiatrist. And many patients come into the office depressed, wanting help for that. And sometimes they're pretty desperate. And it's still not a very easy thing to treat because, at least with medication, because if you give them medication, give the patients medication, it takes generally at least a few weeks for the medication to kick in. And in the meantime, the patient has to stay depressed and take the medicine every day. So it's not an ideal situation. But just to back up, do antidepressants work? Bottom line, in my opinion, yes, they work. For some people, sometimes, but not always. They can be life-saving. Some people are very grateful for antidepressants. And other people feel terrible on antidepressants, don't like them at all. So it can vary quite a bit depending on the patient. And any antidepressant, even if it's effective for depression, can have side effects. So that could be emotional blunting. Low libido is a big one, very common. And it seems like it's connected to me with the emotional blunting. The antidepressants often, not always, but often seem to blunt or potentially blunt emotional responses to the point where people have less ability to cry if they hear something sad or watch a sad movie, and they also have less ability to climax, so less emotional and sexual responsiveness often. You want to ask before you start an antidepressant, you want to make sure a woman's not pregnant, not wanting to get pregnant in the immediate future, not breastfeeding, not wanting to breastfeed. Those are not black or white areas. Some people take antidepressants during pregnancy and while breastfeeding, but you want to know before you start an antidepressant. Another big thing to know before you start an antidepressant is what other medicines is the patient taking. For instance, if someone's on a blood thinner, Coumadin, Prozac may well not be the best antidepressant because Prozac can elevate levels of Coumadin in the blood, and that can cause problems with the blood potentially being too thin and the person bleeding. Potentially, you can get genetic testing nowadays for enzyme systems and try and tailor an antidepressant to the patient's genetic functioning of enzymes. If possible, it's a good thing. It's not an absolute necessity, but it's a good thing to have an EKG because some antidepressants can affect the cardiac conduction, can cause what we call QTc prolongation. It's also wise, if possible, again, not an absolute in general before you start an antidepressant, but it's often good to know the liver function. You want to check liver function tests, know the kidney function, BUN creatinine, know electrolytes. Many antidepressants can cause hyponatremia, so low sodium, which can potentially, if it's severe, be dangerous, cause seizures, for instance. So all those things are good to know. Another good thing to know is family history. Let's say you have a patient and their sister did very well on Zoloft. Probably it's a good idea, potentially at least, to start Zoloft or try Zoloft. And like I mentioned, these antidepressants have to build up in someone's system. They have to be taken daily for at least about a month to know if they're going to be effective or not. And that's a grind for patients, especially patients who are desperate to feel better, who are very depressed. Another issue to consider with patients and let them know about is if they take the antidepressant for a while and then stop taking it, often there can be a withdrawal syndrome. That's especially bad with Paxil and Effexor, and that consists of dizziness, nausea, insomnia, feeling agitated like they have the flu. So very unpleasant. And some patients take that to mean that they really need the antidepressant, but the withdrawal syndrome in itself does not necessarily mean that someone's so depressed that they need an antidepressant. It just means the antidepressant wore off, and by wearing off has caused some pretty unpleasant effects. Sometimes antidepressants lose their effectiveness after a while, and that can be surprising for people. Let's say they've been on an antidepressant for a couple of years. All of a sudden, after a year or two or a few years, the antidepressant stops working. And that's, of course, very unpleasant. And some people at some point just want to get off their antidepressant, and that may be reasonable, but they have to realize that just like the medicine takes a while to build up in someone's system, build up in their body, in their blood, in their brain, and affect neurons in their brain, just like it takes a while to kick in, it can take a while to kick out, and quite some time actually, because people may stop an antidepressant and do well for 6 months, 9 months, but then they can crash and become depressed again. So that's something to discuss with patients before considering stopping an antidepressant. Thank you.